Uganda Cancer Institute has revealed that there is an increase in the number of cases of cancer among children. From 7% before, the number has raised up to 10%, with most of the sick children coming from the central, eastern and northern part of the country.
The central part of the country has the biggest cases. It is just simply because services are actually concentrated here. And if we look at our statistics here at the Cancer Institute of the patients who come here and we find out where they are originating from, actually we find that it is only about 15% who are actually resident of the central region.
On average, 1,700 new patients with cancer each year are registered. Of about 700 are children. The Executive Director, Uganda Cancer Institute, Jackson Orem, highlighted that the cancers that affect children most often occur in the developing cells like the bone marrow, blood, kidneys, and nervous system tissues. The most common cancer is called Burkitt's lymphoma, which most commonly affects the fascial bones.
Every child who comes to the clinic or comes to the health center or falls sick has the common presentation of childhood illnesses is a candidate for a diagnosis of cancer. So if we catch it early, we can actually treat the cancers in children with the intention to cure. The problem is that what I've just said, that in most cases people ignore. They think that cancers are not occurring in children. So for that matter, when now the diagnosis is made, it is usually advanced. And so that means children who die from cancer because their disease has come late is just simply because the recognition has actually taken longer.
But one would ask, what causes cancer among children and what can be done to prevent it? Conditions such as Down syndrome, specific chromosomal and genetic abnormalities, ionizing radiation exposures explain a small percentage of the cases.
Diagnosis of cancer or the, I would say, suspicion of cancer should not come at the tail end of the process. It should actually be at the forefront in as far as suspicion of whatever is causing a child to come to a clinic is concerned. So I think that's number one.
And even then, every cancer patient would love to live in a conducive environment for easy management. Plascon Uganda has donated paint for the children's ward.
We are very happy that, especially for children, it will be a better environment for them. It will help in uplifting their mood and basically maybe help in coping with this disease a bit better.
Really because the need to support and help in any way to fight cancer and to give hope back to the patients that are suffering is enormous, and it's a call that we all must heed.
The paint is to help beautifying the structure and equally create a conducive environment for the patients.